diabetes in the past have been relegated as a person that does not have enough insulin. But now we have come to the conclusion that diabetes is not related to an insulin deficit disease. Diabetes is related to insulin resistance within the cell wall of each one of our cells. And we can change these insulin resistance within the cell wall in order to improve the insulin's function within one's body. So diabetes can be now considered to be a different type of disease than before, and we are treating it differently than before. So quite often many the food supplement that we use like Circulife can changes the insulin resistance by increasing circulation to the cell wall, by increasing the by activating a pathway called PPAR gamma pathway, which will increase the insulin sensitivity, in turn decrease the insulin resistance. So many of the medication, however, when we give it to patients like Acto, which is a newer medication, Evendia, Ritalin, all of them are able to decrease insulin resistance or increase the insulin sensitivity. Unfortunately, these medicines have very severe side effects like hepatitis, drug-induced hepatitis, drug-induced renal failure, also cardiovascular type of problem. Because of that, many of these medications were taken off the market. But many food supplements like Circulife, like bitter melon, cinnamon, and even ginseng are able to induce this pathway without causing much of any disease process or complication or side effect. So Circulife is one of the medicine that will do that, or food supplement that will do that in helping reduce insulin resistance, and therefore in turn make the insulin much more effective, and the body does not have to produce as much insulin. In return, you kind of safeguard the capacity of the pancreas to secrete insulin, in turn protect and extend the lifespan of your pancreas. In other words for that is that you are now delaying the onset of diabetes, and also preserve the capacity of the pancreas to secrete insulin, therefore extending your lifespan of your islet cell within the pancreas, in order for the person to produce more insulin for a longer period of time. So now our treatments for diabetes are quite different than before. We talk about lifestyle changes, to eat differently. We also talk about using different kind of food supplement to help increase the insulin resistance. In decreasing the insulin resistance, or another word for it, increasing the insulin sensitivity. So by doing that, patient would delay the onset of diabetes, delay the reverse some of the diabetes process within the person's body. So this is a new concept in treating diabetes type 2, and I hope that more people would follow this way of treating diabetes, rather than using the old way of treating diabetes by squeezing the production of insulin within the pancreas cell, and eventually exhausted the diabetes the pancreas capacity to produce insulin. So now what do we need to do nowadays to measure diabetes? Now we need to do three things that are most important for diabetes. The number one, actually there are three things. One is fasting insulin level. This indicates how much insulin resistance is ongoing on your body. Two, you need to measure the fasting glucose level, which is many people use to measure measure diabetes. Number 3 is hemoglobin A1C. Those three are used to measure the beginning and how severe is your diabetic. If insulin is raised, beginning to rise up to certain level, then you know that insulin resistance is beginning to develop in your cell wall, and you know that this patient will eventually develop diabetes. So when the insulin level goes high enough and the insulin resistance becomes very strong, then glucose level begin to rise. So when glucose level rise above certain level for extended period of time, usually around 3 months, then hemoglobin A1C begin to rise. So in any patient, any two of them are higher than normal, then the person is diagnosed to be diabetes. But if only fasting insulin level is high, the glucose and A1C is within relatively normal level, this person is considered to be metabolic syndrome or pre-diabetic. So what you want to do is prevent a person having pre-diabetic to become diabetes, and treating them at that point is the most important and crucial in arresting the diabetes from progressing, or metabolic syndrome from progressing into full-blown diabetes. So I believe that Circulite would help avoid patients from progressing from metabolic syndrome into diabetes. And if the person already have diabetes, it will stabilize the glucose level. It will also make patients' diabetes much more easily managed with the medicine they are taking, since there will not be fluctuation of glucose up and down that way. So this would be the best way to treat diabetes. Prevention, and to, once you develop diabetes, to stabilize the disease so that it will be well managed with the existing medications.